Welcome! This video will guide you through collecting a capillary blood sample using the at-home blood collection kit. When unpacked, your kit should contain the following components. Please read the accompanying instruction booklet before using the kit. Before you begin, please be aware that sample collection can take 30 to 60 minutes. Ensure the room you are sampling in is heated to a warm and comfortable temperature. Have a drink prior to taking the test to ensure you're hydrated. A warm drink is preferable. Firstly, clean, clear, and dry a flat surface to place the home test kit on. Complete the patient form provided using a ballpoint pen. Soak your hands in warm water for a timed 4 minutes to encourage blood flow and making it easier to collect your sample. Be aware that failure to perform this step could result in sampling issues. Dry your hands thoroughly after. Remove the cap on your collection tube by twisting and lifting it off. Keep the cap with your collection tube to ensure the cap is returned to the same tube. Place your tube in the stand provided. To begin collecting your sample, choose either the middle or ring finger on your non-dominant hand. Wipe your chosen finger with the alcohol wipe and allow to air dry. Twist and pull the removable cap of the lancet. Place your hand palm up on a flat surface. Position the lancet tip towards the side of your fingertip, then press down firmly. Apply gentle pressure to the area around the cut to encourage the flow of blood. Wipe away the first drop of blood using the alcohol wipe provided. Press the lip of the tube against your finger, allowing the blood to run down the inside of the tube. With your dominant hand, gently massage your finger in a downwards motion until the tube is filled between the two lines. Once complete, recap the blood collection tube and push down on the cap until you hear a click. After the collection tube is closed, gently turn it upside down and back again, 5 or 10 times, depending on the cap color. Place the filled tube back into the holder if you are sampling multiple tubes. Clean the lancet wound with a saline wipe and apply a plaster to prevent infection. Repeat these steps for all the tubes you have been provided with. If you are unable to get enough blood from this finger, try shaking your hands at waist height, performing star jumps, or taking a warm shower or bath. After these additional preparations, repeat the process on the unused middle or right finger using a new lancet. Once all the required tubes are filled, wipe the collection tube or tubes with an unused alcohol wipe or tissue before preparing your sample for return. Place the blood collection tube into the sample return pouch and follow the instructions on the pouch to seal it. Then place in the return box along with the completed patient form. Seal the return box by removing the paper strip covering the adhesive and close. Return your sample in accordance with your instruction booklet on the same day of collection. If you have a sharps bin, place all used and unused lancets inside. If not, place these lancets in a rigid container, such as an empty coffee canister or laundry detergent bottle, and secure with tape. This can then be disposed of in normal household waste, along with all other items included in this kit. Thanks for watching. We hope that this video has given you guidance on the best practices for collecting a capillary blood sample. For any questions or concerns, please contact your healthcare provider. Your healthcare provider will contact you with the results when they are available.